Hello anatomy colleagues, this is Dr. Alsup, and in this learning objective video we will be discussing big picture concepts regarding the neurovasculature of the upper limb. So as I believe you get at this point, when I say neurovasculature, I'm meaning arterial supply as well as venous drainage, basics in terms of innervation, and we'll even talk a little bit about lymphatic drainage. We're going to start with the arteries, as understanding this basic pattern will help with some of the other areas, particularly the veins. And what is neat about the upper limb and the lower limb, which we will discuss in another video, is that one artery source will supply the whole thing. And there will be some name changes and of course many branches along the way. But when talking about the upper limb, the subclavian artery is going to be the main source of blood to the entire upper limb. Its branches will specifically supply the root of the neck region as well as some of the shoulder muscles, and it will transition into, or more plainly, its name will just plain change to the axillary artery at the lateral margin of the first rib. So here we have the subclavian, and here is that first rib right here. And you have that name change into the axillary artery. As you might imagine, the axillary artery is located in the axillary or armpit region and will supply structures around there, such as shoulder muscles. The axillary artery will transition into the brachial artery at the inferior border of the teres major muscle. Now, the brachial artery is going to supply structures associated with the brachium or the arm, so those arm compartments. And at the cubital fossa, which is this general region right here that I'm circling, it's this anterior depression in the elbow region. The brachial artery is going to split or bifurcate into the lateral radial artery and the medial ulnar artery, so named after the bones that they are most closely related to. The radial artery will supply lateral portions of the anterior forearm, as well as being the dominant supply of the deep palmar arch, so you can see that here, in the hand. It will provide some blood to the superficial arch as well, but is dominant for the deep palmar arch. The ulnar artery supplies a larger expanse than the radial artery, with supply to the medial and deep portions of the anterior forearm, as well as the posterior compartment of the forearm, and portions of the hand, specifically being the largest contributor to the superficial palmar arch, with a role as well in the deep palmar arch. There's variability in terms of the anastomoses there. Moving to veins, in the upper limb, the superficial veins, so the ones that are closer to the skin, are the dominant veins in terms of size. And as the name would suggest, these are located more superficially in position, so typically superficial to the muscles. The cephalic vein is the dominant lateral superficial vein, so you can see that here, with the basilic vein being the more medial superficial vein. And there is also going to be a vein that is also located in that cubital fossa region that can be a shunt of blood from the cephalic vein to the basilic, referred to as the median cubital vein. And there's considerable variability in terms of the median cubital vein. I mention it here as this is commonly discussed as a major site of venipuncture, but really any superficial vein can be used for venipuncture. There are, of course, deep veins as well, which tend to be a little smaller in caliber, but not always, and these typically follow the arteries very closely. In fact, it's often difficult to separate these, and they typically travel in pairs called vena comitans or comitantes. And so you'll have radial veins that travel around the radial artery and ulnar veins around the ulnar artery, brachial veins that travel around the brachial artery. And so that's why kind of understanding the arteries names will help with at least the deep veins. Most of these deep veins are going to drain into the basilic vein or more directly into the axillary vein. Now, to head back towards the heart, the superficial basilic vein typically meets or coalesces with the brachial veins to form the axillary vein. At that same boundary for the arterial name change, so that inferior margin of teres major muscle. As we hopefully remember, the axillary vein will transition into the subclavian vein at the lateral margin of the first rib, and we can recall the rest, with that subclavian vein joining with the internal jugular vein to form the brachiocephalic veins, which coalesce to form the superior vena cava, which we remember drains into the right atrium of the heart. On to nerves, and I want to note we will explore innervation of the upper limb in more granular detail in upcoming sessions as we discuss specific muscle compartments. So we're focusing on very, very big picture here. The majority of the upper limb is innervated by the brachial plexus, as I think you likely know at this point. So this includes both somatic afferent or cutaneous innervation, as well as efferent or motor. And so much more to come on the brachial plexus. I do want to note that it isn't all brachial plexus though, particularly in the proximal regions in terms of the cutaneous or somatic afferent innervation. There is some supply from branches of the cervical plexus and even a branch of T2, so distal to the brachial plexus typically, with this intercostobrachial nerve here. So this region, and this is just showing an anterior view, is going to be innervated by non-brachial plexus nerves. There are postganglionic sympathetic fibers that travel in many branches of these plexuses, and we need these sympathetic fibers in order to serve roles in vasoconstriction, as well as initiating secretion of sweat. So sympathetics do make their way to the limbs, but parasympathetics do not, which makes sense when you think about the role parasympathetics play. That has very little to do with the limbs. And lastly, let's take a quick moment to consider the lymphatics in this region. Typically, the superficial lymph nodes and drainage follow the veins that we just discussed, which makes sense as these are fairly large in size, and the deeper lymphatics or deeper lymph vessels will follow the arteries. Although, keep in mind, those deep veins follow those arteries quite close, so it's really almost a unit. The major point I want you to take away here in terms of the lymphatics is that the lymphatics of the upper limb will drain towards the axillary lymph nodes. And this is a general grouping. Don't worry so much about memorizing these specific ones unless in another area of the curriculum. But this grouping of lymph nodes is all in this axillary region. And it's in this region that noticeable enlargement of lymph nodes are often noticed. All right, excellent. We have reached the summary slide. As you can see here, I've created a nice flow chart for you for the arteries, but you can also look through the illustration as well. This shows some of the branches too of these arteries that we discussed. Then, of course, the major takeaway points from this material. All right, so please take time to review, and as always, reach out to me or any of my anatomy colleagues if you have any additional questions. Thank you for your time and attention, and have a great rest of your day.